pregnancy and childbirth are essentially meant to be sources of joy and happiness for most parents and families. However, in many cases, this is a moment of pain and sorrow. Parents and families become victims and recipients of maternal deaths, as well as long-lasting illnesses or disabilities caused by complications of pregnancy and childbirth.
Watu wengi walikuwa wanazalia manyumbani, wengine wanapelekwa Taveta. Kitambo ufike Taveta unaweza pata mtoto wako amechoka, anatoka akiwa amekufa. Wewe unapona hivyo hivyo, ama wewe unakufa mtoto anatoka.
Maana mtu anaweza kuja mbio kumba yeye aliathirika. Akaja tayari, wewe nisevu, mimi sitaenda hospitali. Ukimwambia hutaenda hospitali kwa nini? Ati hayo ni yawe yako na mimi. Sasa hapo hutajua, uona mara hivi mtoto ameaga dunia. Sasa kwenda wewe kuripoti hutaweza. Itabaki zi.
According to the World Health Organization, WHO, in every single year, more than 500,000 women die from causes related to pregnancy and childbirth, and nearly 4 million newborns die within 28 days of birth. Millions more suffer from disability, disease, infection, and injury.
Before then, mothers used to go to our neighboring country, Tanzania. The worst thing is that they were delivering at home, being mismanaged by our TBAs, so we get those mismanagement cases to our facility. Even sometimes we had to refer them to our sub-county facilities.
For over 50 years, Pathfinder International has worked to catalyze change in Kenya through strategic partnerships aimed at enhancing and promoting people's access to health-related rights. Throughout this period, the organization has supported integrated and comprehensive services for maternal and newborn care. Since 2011, Pathfinder has been the lead organization implementing the AIDS, Population Integrated Assistance, commonly referred to as APHIAplus Nairobi-Coast.
APHIAplus Nairobi-Coast is a 5-year funded program by USAID, which is implemented by 5 strategic partners, namely Pathfinder, who is the prime partner. Then there's Child Fund, whose special focus is on orphans and vulnerable children. We also have CLUSA. This is another American organization with a major focus on looking at empowering families and communities in terms of economic livelihoods. NARESA is basically a clinical partner that had a major responsibility of ensuring clinical mentorship. Then last but not least, we also have PSI, and PSI's major focus was on behavioral prevention and also addressing issues of key populations in Nairobi. But it's also important to note that APHIAplus was not only being implemented by the 5 strategic partners that I've actually mentioned. We also worked with a number of local organizations, both CBOs, NGOs, and community units that had put formal structures in place that warranted us to be able to give them the much needed support.
Under this program, and with regards to maternal and neonatal healthcare, Pathfinder's approach is influenced by the notion that pregnancy, birth, and motherhood in an environment that respects women can powerfully affirm women's rights and social status without jeopardizing their health. Therefore, it works with the government and other stakeholders to enable environments supportive of safe motherhood and childbirth. APHIAplus supports and encourages such essential actions as antenatal care, skilled attendance at birth, postnatal care, access to emergency obstetric care when necessary, growth monitoring, adequate nutrition, newborn care, immunization and education to improve health, infant feeding and hygiene behaviors.
Kwanza kuna mila. Kuna kina mama wengine ambao hawezi zalishwa na mtu kutoka nje ya boma. Pili, kuna mama wengine wanaogopa kuja hospitali. Tatu, there is also negative attitude kwamba kule hospitali la wahudumu ni wabaya. Hii ni baadhi ya mambo ambayo kwa kweli nafanya watu wengi kutofika hapa hospitali. Kwa hivyo tukaona kwamba tukasema kila CHW identify TBAs wake kule waje nao hapo katika mkutano ambao ulikuwa funded na APHIAplus, tukaletwa wote on board. That's why we formed this chama cha TBAs hapa hospitali.
A warm sunny day, Jessie Tembo Mavuna is doing what she loves most in the comfort of a tree shed in front of her makuti thatched house. Jessie is one of the over 200 traditional birth attendants from Goa village who are converted into traditional birth companions through APHIAplus led program.
Tukasema siku hizi kuna maradhi na usalama mzuri ni hospitali. Kuzaa kule nyumbani ni hatari. Waweza kuja ye mzazi hana gloves, hana chochote. Itakubidi wewe ushike na mikono yako. Kumbe mtu ameathirika, ni mbaya, wacheni. Tulipofanya mkutano wa kwanza, mkutano wa pili, mkutano wa tatu, tukawa tukishika mzazi tunampeleka hospitali. Sisi wanazalia hospitali.
So we decided to sit with them, have dialogue. If she delivers at a facility, these are the advantages. First, she'll be attended by a skilled birth attendant. Second, in case of any complications, we have ambulances. She can be referred to Kilifi County Hospital for further management. So after having dialogue with them, they accepted to be birth companions, after having seen the advantages of delivering at our facility. After having dialogue with them, we realized that we have to do something on incentive. So we also started we started giving them some incentive.
Tulikuwa tunazalisha watu 54. Lakini all of a sudden kuja wale TBS, tukaenda 90. Mwezi uliopata ulipochacha kweli kweli tukafika 120, mwezi uliopata 130.
Right now we are standing at our deliveries by skilled service attendants has gone up to almost 70%. When before we started we were at 42%.
One of the advantage that the program took was to ride on the policy of free maternity services, because that was one clear barrier that had been removed by the government. But we also acknowledge the fact that it's not just the fee that was a barrier. There were many other cultural issues that needed to be addressed. And these are some of the issues that we see that the program brought in the value addition.
During the process of delivery, after delivery of the placenta, it is put into a container. Before I go and dispose it, I tell the mother, we do not bury anymore, but we have got a certain place where we put all the placentas, and the place is well secured. The construction of the placental pit has really raised the numbers of deliveries at this facility from 3 per month to 15 per month.
Nijifungulia hapa hospitali na nikuja hapa hospitali kwa sababu hospitali ni kuzuri, kuna uangalifu mzuri zaidi kushinda nyumbani. Unapozaa unaangaliwa kama njia yako iko sawa ama iko tayari na kutoa mtoto, lakini nyumbani kule hakuna hivyo. Wanasema sukuma tu, halafu mwisho wake mtoto anaweza kuathirika au hata wewe mama pia. Wanachimba shimo tu na jembe, halafu mbwa anaweza kuja chukua, ama mtu yote ambaye ni mhalifu anaharibu maisha ya mtoto wangu. Sasa ukija huku huwa kuna uangalizi mzuri, hata katika kufunga ile kitovu inafungwa vizuri, halafu na ule muji unaenda kuwekwa mahali mazuri.
There was a building already, an old building. We didn't have a maternity wing. The mothers used to deliver there, so we have to keep patients on hold as we deliver a mother. You don't know the time that it's going to take. So when APHIAplus came in, they were able to renovate it to a standard that is workable to the staffs and the community at large. And mothers got wind of the fact that there is a maternity, because when they are coming for ANC, antenatal care, usually bring them here, they see our maternity, they are satisfied.
Nilijifungulia Coast General Hospital na nikaona mambo yao si mabaya, ndio nikaendelea kuwafuata.
Na kuna pia umuhimu kuja hospitali kujifungua kuliko kwenda kwa mkunga, maana waweza kuwa na shida ambayo wale hawawezi na hapa hospitali waweza saidika.
Okay, importance of the mothers coming to the clinic. First of all, we ensure at the end of it all, the mother gets a live, healthy baby, and she's also healthy. We give health education on diet to the mothers when they come here, and when they come early, we shall be able to identify any problems that will be a problem to the mother and the coming baby.
Mimi nilipoanza kuja kliniki, nilikuwa na mimba wa mwezi mmoja. Nilikuwa na shida, nilikuwa na bleed. Sasa ikabidi niletwe huku. Kuletwa huku au alichukua hatua immediately. Hawakuniachilia. Niliingia hivi na barua, wakachukua, wakanishughulikia, damu ikastop. Wakasema bado tutafanya bidii huyu mtoto atoke kama kwa alive. Sasa nilifurahia sana. Walinisaidia, kwa kweli walinisaidia.
Men have been empowered, and they have at least allowed their women to be able to go to the facilities, especially to have them take their children for child monitoring, growth monitoring, immunization, and even the mothers themselves to go for the ANC visits.
Tulipotoka kwa training tukaja tukaunda makundi ya male champions. Kwa hivyo katika hao male champions tukawa tunaingia kwa vijiji kuhamasisha hawa wazee akina baba ili wapatie nafasi akina mama ya kufanya uamuzi wakati kuna tatizo. Alafu kuna mambo ya kulea watoto. Kuna zile huduma ambazo nizipatikane hospitali. Mara nyingi huwa ilikuwa ni mzee apende ndio huyo mtoto apelekwe kliniki, na hata kama mzee atapenda basi ni mama peke yake ndiye atampeleka huyo mtoto. Lakini katika male champions tukawa tunahamasisha wazee mara nyingi wawe wanaambatana na kina mama kuwapeleka watoto.
Let us select on one module on how we can register a new client on pregnancy.
In certain community units, the program has integrated the use of mobile phone technology, also known as mHealth, to ease the work of CHVs and ensure better results. This technology improves a simple text messaging tool that CHVs use to conduct routine surveillance of health events during the course of a woman's pregnancy, delivery, and thereafter.
So what we did as APHIA, just to pilot mHealth, was we bought mobile phones for the 300 community health workers and trained them through the application. And what the application consists of is an application, one for a pregnant mother and another one for an orphan and vulnerable child. So this application on the mobile phone assists the health worker to provide service to the mother and the OVC. So what the community health worker needs to do is to go and register the mother, and they are probing questions in the app which necessitate the health worker to provide more service in case of need.
Sisi tuliletewa simu. Kuna mtindo ama type nyingine ya kuhudumia jamii ambapo ni kama ni application imeletwa kwa simu ambayo inaitwa ComCare. Hii simu imenifanya mimi nimekuwa mwepesi wa kuripotia, ambapo pia imenisaidia katika ile hali ya kukumbusha wale wakina mama ambao ni wajawazito kuwaleta hospitali, ama kama ni wakati pengine time ya kujifungua imefika, huwa kuwakumbusha wao inakuwa ni rahisi kwangu.
The information we get from the CHVs, it helps the facility to intervene and plan in a way that when the CHV reports on a certain indicator which becomes like it's a common indicator for our community, the facility then now intervenes. Like in a form, they can bring a community action day, They can bring like a sensitization week, like the Malezi Bora week, the breastfeeding week.
The other advantage of mHealth and the mobile phone is when the community health worker visits a mother and takes all the parameters and enter the data in the mobile phone, at the end they click send. That to us is real reporting.
It is a well-known fact that breastfeeding has far-reaching health advantages. Breast milk provides the ideal nutrition for infants, and the WHO has established beyond any doubt that breastfeeding reduces child mortality and has health benefits that extend to adulthood and beyond. Breast milk has a perfect mix of vitamins, protein, and fat that the baby needs to grow. It promotes development of the mind and protects the infant against infectious and chronic diseases.
These mothers or the community has the belief that if a mother delivers, then the breast has to be cleansed. So you find that this baby can stay for more than 72 hours waiting for somebody to come and clean the breast as far as their belief is concerned. Then the other thing is that the first milk, which is cholesterol, to most of the community members believe that is not a right milk for the baby.
Hichi kikundi kilianzishwa mwaka wa 2011, kilianzishwa na MOH na Gotani Dispensary na APHIAplus. Ndio walikuja wakatufundisha kuhusu jinsi ya kunyonyesha watoto, na sisi tukaelimishwa, tukaona ni vyema tuingie vijijini ili tuelimishe wenzetu, na mpaka sasa tunaendelea kuelimisha jamii kuhusu kunyonyesha. Tunakuja kwa clinic before madaktari waanze kliniki yao ya usubuhi. Kuna health talk pale tunapeana kwa mama, tunafundisha wamama kuhusu umuhimu wa kunyonyesha na jinsi ya kupakata yule mtoto anyonye vizuri ili maziwa ya mama akaweze kuachilia.
Kwa wale ambao wako na virusi vya ukimwi wamesaidika pia, kwa sababu wamefunzwa mengi kuhusu kunyonyesha mtoto. Kuna kitu ambacho tunasema wakati mama anaponyonyesha mtoto kuko na ile attachment and positioning. Kwa hivyo hiki kikundi kimesaidia hawa mama ambao kuna virusi kwa attachment and positioning, na hiyo inasaidia kupunguza, na pia wanaambiwa umuhimu wa kunyonyesha mfululizo kwa miezi 6 ambao pia inapungua, na watoto wao na hao wenyewe wanakuwa na afya njema pia wakinyonyesha vizuri na wakinyonyesha kwa ubora. Tumeweza kuona ya kwamba utapiamlo umepungua katika facility hii yetu. Tukiangalia records tunaona kwamba in March 2012 tulikuwa na cases 399, na saizi Januari 2015 tuko na cases 84. Kwa hivyo tunajua na tunaona kwamba hiki kikundi kimetusaidia zaidi.
Newborns in special circumstances such as low birth weight babies, babies born to HIV-positive mothers, or sick babies require additional care. APHIAplus Nairobi-Coast has supported health facilities within its operating areas to offer postnatal care and ensure newborns and their mothers better health outcomes.
Nilikuja first, nikatestiwa, nikapatikana positive, nikaanzishwa madawa, ndipoza nimezaa mtoto. Mtoto alipimwa ako negative.
We follow up all antenatal mothers who are both positive and negative mothers, of which the ones we've tested positive are 64 as per now, and out of the 64, 38 have delivered. The rest are still expecting and they are on heart. Those 38 who have delivered all have tested negative. The children are negative. Those still on follow-up also.
We supported PMTCT services in line with the national guidelines. The aim of this was to eliminate mother-to-child transmission of HIV. The project aimed to ensure that the transmission rate was less than 5%. When the project started out, the transmission rate stood at 14%. Towards the end of the project, the transmission rate had gone to 8%, with some counties presenting as low as 5.5% of transmission rate.
As Pathfinder itself, our mission is that no woman should die while giving life to another. One mother or one child saved is really part of the success of this program.
APHIAplus Nairobi-Coast is winding up, but leaving behind happier clients, mothers who have delivered and going home with healthy babies, HIV-infected patients receiving ARVs near to their homestead, and be able to come out without fear of stigma to say that we're HIV positive and receiving result.
Sisi tumefaidi hasa uno mradi wa APHIAplus, tunawashukuru, lakini pia ina muhimu wengine pia wapelekewe huu mradi ili wanufaike pia hao.